And just one
Yeah.
thing on the topic of HRT, I remember hearing you talk once about how someone, in most cases, someone drinking alcohol increases their risk of breast cancer more than taking HRT. Is that
Yes.
correct?
Yes. So actually carrying excess body weight or drinking alcohol, even 2 or 3 units even 2 units of alcohol, if I remember right, is actually, you're worse off than taking hormone replacement therapy or the combined oral contraceptive pill for a long time. So, it is understanding what your risks are. 1 in 7 of us have a lifetime risk of breast cancer. And so it is important to understand that there are a lot of things we can do to reduce our risks, but at the same time, not blame medications that can actually hugely improve the quality of a lot of women's lives and, is right for them. But again, there should be no medication shaming. But similarly, if you choose not to take hormone therapy, there is no shame in that too, because I know right now there's a lot of push for everybody to take HRT, and it may not sit right with you. So, but don't be afraid of anything, any aspect of it. Like I said, even in lifestyle, there are so many people who will advise you to eat things like red meat and animal-based products. And, these things do not bring health long term. It's fine if you eat them occasionally, if that's what you choose to do. But, eating processed meat, which is another class 1 carcinogen, these are things that don't bring you health. And we know that eating plants over and over and over again, population studies have shown us that they are actually good for you, good for heart health. There's no different diet for reducing the risk of heart disease, reducing the risks of cancers, reducing the risk of dementia, reducing the risk of, painful periods, heavy periods, endometriosis, fibroids, menopausal symptoms. It's all the same. Prostate cancer, it's all the same way of living, the same way of diet and way of eating and way of, enjoying life. It's important to understand that. And community, again, is really important. So surrounding yourself with people who think like you so that you can actually feel motivated rather than dragged down, I think is so, so important, because you guys have built such an amazing community around you. And that's what I hope through all your courses, the Happy Gut course, the Happy Mind course, the Happy Menopause course now. You want to actually bring people in so they can actually exchange ideas and, sort of empower each other, because it's all very well as a doctor for me to keep talking, but when people see the changes themselves, they will then start, it'll trickle down into their community that they live, and they say, wow, did you hear? It's so fantastic when you eat a bowl of dal that is really doing, you so much of good. And so it's not that you don't want to eat the donut or the omelette. It's just that every time you put something in your mouth, you have to think, am I bringing health or am I hurting myself? And so in that situation, yes, keeping those things as treats, but actually choosing a bowl of porridge or tofu scramble over an omelette, choosing a minestrone vegetable soup with lots of beans in it over a chicken soup. These are simple things, simple changes that one can make that really will bring health and happiness into your own life. And so I hope I've been able to get that message across. And, there's lots more information that we talk about.